March is National Kidney Month, and while many Americans are at risk for kidney disease, not everyone is aware of it. According to the National Kidney Foundation, 1 in 3 Americans are at risk for kidney disease. 660,000 people live with kidney failure, and around 100,000 people are awaiting a kidney transplant. Now listen to this, though. Black and African American people make up 13% of the U.S. population, but represent 35% of those with kidney failure treated with dialysis or kidney transplants. Now there are important strides being made in testing for kidney disease without discrimination. Joining me now in the studio is Dr. Emily Volk. She is the president for the College of American Pathologists and VP of Pathology and Clinical Laboratories at U of L Health and a member of the U of L School of Medicine. Now, you're raising awareness about some changes to testing, talking about estimated glomerular filtration testing. It's a bit of a mouthful. It's not something everyone understands. What is it?
So estimated glomerular filtration rate, or EGFR for short, is a measure of how well your kidneys are taking out the toxins in your blood and how well your kidneys are working. So it's a tool that doctors use to identify patients who are at risk for more severe kidney disease.
Now, what are the changes that are now being made to that testing, and why are they so important?
Well, for years we used sex and weight and race to adjust the number for estimated glomerular filtration rate, EGFR, in addition to measuring the blood levels of a protein called creatinine. And that is something that the muscles make. And we can track the filtration of creatinine in the blood by the kidneys. And we would adjust that number up and down whether or not someone was a Black American or not. And so now we understand that race is really not a biological thing, it's a social construct. So by making an adjustment for Black Americans, we were actually reducing the number of people that we were identifying as potentially having kidney disease. And unfortunately, denying some people of the care that they really did need.
Yeah. Now, it is National Kidney Month, and these changes can directly impact things like life-saving kidney transplants. Can you tell us a little bit about how that goes into that?
Absolutely. So if you're identified as having an EGFR that is too low, then your doctor will put you on potentially a list, a transplant list, someone who is qualifying for a kidney transplant. But if that number is too high, because we've adjusted it because of your identifying as having a Black race, your name would not necessarily be on that list. So now that we've removed that designation, removed that adjustment, more Black Americans will be identified as having kidney disease earlier, hopefully preventing some people from needing transplants at all because they're getting life-saving treatment before it gets that bad.